So, hi everyone. This series was inspired by an invitation-only roundtable hosted by Global Policy Network that took place on the 25th of June 2025, titled The Role of Medicines in the 10-Year Plan, chaired by Yousaf Ahmad, GPN Advisor and ICSG Pharmacist. Yousaf then later joined us as a guest on the series. To help us to explore the key findings from this report, we are joined today by GPN Associates Maria Nasim and Stephen Riley. So thank you so much, Maria, for joining us today, and Stephen for continuing the conversation. How are you both today?
Thank you for having me. I'm very well and quite looking forward to the conversation ahead.
That's great. I'm really good, thank you. It's great to be back with you again. I'm really excited, Maria. I'm really excited to be part of this conversation.
To start us off, the roundtable focused on medicines in the 10-year plan, and the report goes on to capture the discussions, insights, and recommendations together with what we should start, stop, and scale. So, Stephen, in your opinion, why was this discussion needed, and why now?
I think it was really crucial within the 10-year plan. It really helps outline the key ambitions for health of delivery of the next 10 years, particularly the shifts from treatment to prevention, from hospital to community-based settings, and also from analog to digital. So enabled to deliver those three shifts, and also the ambitions which are clearly laid out for a pharmacy and medicines perspective. And as a profession, pharmacy was really fortunate. We had quite a lot of actually specific mentions for our role in the 10-year plan, and particularly the better increased use of a community pharmacy, more clinical service delivery, and better use of pharmacists as prescribing clinicians. So enable for us to deliver this effectively and take our role and as healthcare providers out of the future and what the public and population will need from a health service, it's really crucial now we really review what are the activities we're undertaking currently, what needs to change, what should we be doing more of, what do we need to scale back on, to enable us to partly to free up our time as clinicians to deliver these key elements, and also as different professional sectors. Also, how we can better utilise our workforce and our wider teams to support us. There'll be key roles that we may currently have a focus on now that aren't crucial for us to deliver as the pharmacist specifically, that could be undertaken by other colleagues. So obviously our pharmacy technician professionals who are highly qualified and trained colleagues, our wider pharmacy teams, are the things that could be better placed done by other professionals or other parts of the system. And it's really crucial overall to make sure we get the best outcome for our resources that we use within our health service, and make it an NHS fit for the needs of the population now and the population in the future.
Thank you. And Maria, to you, how does this report build on or challenge existing thinking around pharmacy's role in the NHS long-term plan?
Thank you very much, Ramna, for the question. I think what this report does, it reinforces pharmacy as central to prevention, community-based care, and digital transformation, and not just let it be a peripheral service. It also challenges the status quo by saying that we need structural and cultural change within the system and not just like minor tweaks. It also helps embed pharmacy's leadership into ICBs, aligning commissioning and breaking the whole siloed working. And I feel that this is quite bold about pharmacy's role in population health and system transformation, urging policymakers to move beyond the transactional service delivery.
Thank you, Maria. And Stephen, to you, what surprised you the most during the roundtable discussions, and what was the most significant insight from the report?
I think, given it's as with a lot of other healthcare providers and professionals, there's been significant challenges faced by pharmacy in all sectors, in the medicines optimization world, the hospitals pharmacy sector, and particularly community pharmacy sector, challenges around workforce, challenges around workload, pressures from various angles, requirements to make efficiencies, requirements on challenges around abilities and resources available to them and funding availability. So all of this together, you'd imagine would be leaving quite downtrodden and embittered and battled and under pressure. However, what was really great to see, so maybe not surprised in terms of the nature of the people workforce and people we had at the round table, but it was fantastic to see that positivity and people's desire and passion to actually continue to make a difference, look at how we can do things differently, how we can engage with the 10-year plan, rather than viewing this as, oh, this is just another government policy document and it's a new government's new idea. Actually look and see how can we make a difference, how can we play our role. So it was really fantastic to see that spirit and that actual level of engagement and passion to be involved and support change and support developing a better health service and the health service we need for our population. I think one of the key insights for me was, and Maria touched on it as well, it's that requirement around collaboration and integration, which is really essential to stop and break down silo working, having a better collaborative approach between leaders, commissioners, our professional bodies, regulators, and our workforce that's actually delivering the healthcare, and then also better collaboration between us as a pharmacy profession and medicines colleagues, professionals, with other people and other healthcare professionals, GPs, other secondary care, primary care interfaces. All this is going to be absolutely critical and essential for delivery of the ambitions of the 10-year plan. And given the fact we've got very limited resources, we don't have a battalion coming over the hill with a truckload of money to load extra resources. We need to see how can we make the resource we have available work better and get better value for our system and for the resources we put into the NHS and into health and social care.
And Maria, the report highlights persistent barriers to pharmacy integration. Can you walk us through the most critical ones?
Yes, absolutely. So in my opinion, I feel like there's a few quite critical ones that some we are already in the process of tackling, but some I think we just need to go full speed ahead. Number one that I feel is workforce underutilization. So we've got a lot of prescribers and we've got another workforce coming of new prescribers that are not prescribing, and experienced pharmacists don't have funded upskilling pathways, which I feel is very, very crucial. Secondly, we have this whole siloed working and fragmentation. So, for example, community pharmacy, primary care, secondary care often operate independently with little shared governance. It has gotten better since post-pandemic era, and it is getting better. But I feel like it does still need quite a lot of work. Digital fragmentation is another one, I feel, where there is no national fully interoperable system, meaning there might be missed opportunities for seamless care and data-driven decision-making. Again, there are certain areas which are doing this incredibly well, but there can be a more unified approach to that. Of course, we've got the financial pressures as well, which we are seeing everywhere. So this is not something that we have an easy answer to, but it's something that I think is quite critical to have on this list as well. And lastly, on that, I would say is leadership gaps. So there is a lack of consistent representation where you have pharmacy that's being used as reactive rather than shaping the agenda. So I think that's quite important as well. And so, yes, I would say that those are my most persistent barriers to pharmacy integration.
And Stephen, over to you. So digital transformation came up repeatedly. How is pharmacy positioned to lead or lag in this space?
I think it's a really good topic, really, and a good area, because as Maria mentioned, it's one of the barriers to pharmacy integration is the digital disparity. And colleagues really made the point on the roundtable, and I've seen from our own experiences that I think from a pharmacy perspective, we can sometimes be considered maybe a bit of a Cinderella or the ugly sister of in the forefront of digital transformation. There's lots of work has been brought in the last few years, particularly from a community pharmacy perspective, trying to support better integration digitally into access, into patient record access. They can read and see more information from the GP record, updating the GP record with automatically directly from when services are being delivered as that's been brought in a more structured approach and way. And we now have the ability for pharmacy systems to support referrals from other settings into pharmacy, particularly around the GP space to community pharmacy. We've got ability to refer from UEC settings to community pharmacy. We're now doing some work looking at how we can improve digital interoperability between secondary care and primary care settings and community settings. However, a lot of this is still around pockets of good examples, and there are some national programs we are improving. I certainly think the moments we're probably more lagging than leading. There are pockets of good examples. We've got one example in the northwest of a Greater Manchester Share Care record, and there's other examples around the country where pharmacies have been able to be stitched into to view a full patient record, including hospital admissions, social care events, which is much improved. But until we can get fully supported digital transformation programs and we get pharmacy embedded into digital transformation programs at an ICB level and regional levels and wider national levels, we're always going to have that potential being lagging rather than being able to be a leader in the sector. I think digital is going to be really crucial, not only for the analog to digital shift, but as a key enabler to make some of the other key shifts happen in our new ambitions in the plan.
And Maria, what role can industry play, particularly pharma and biotech, in accelerating the adoption of these recommendations?
Oh, yeah. So this question is very close to my heart, and something that I'm very, very passionate about is how can we collaborate between pharmacy or clinicians from mainstream healthcare and pharma. So a couple of ways in which we can do that is there are opportunities to co-develop training and education for new prescribers and digital literacy programs for the workforce. We can partner on real-world evidence generation to show pharmacy's impact and strengthen the case for any investment. We can also have the support for innovative commissioning pilots that link access to medicines with improved patient outcomes. And I think another way in which we can achieve that is help shape data standards and digital solutions that Stephen mentioned as well, that are interoperable and usable across different care settings. And I feel that that collaboration and that missing link between industry and mainstream NHS would be an answer to a lot of the gaps that we have and have been mentioned in the report.
And Stephen, the roundtable had some global health leaders on it, and the report does capture examples from elsewhere. So how did the findings of the GPN policy report resonate beyond the UK? Are there lessons here for global health systems?
Certainly, yeah. I think it was really good to have that broader input from our colleagues more globally, and to learn, opportunity for us to learn how things are done from their perspective, and also an opportunity for us to be able to share some of our key learnings and some of our practices to help support abroad as well. Some of the key elements that came through from the report is highlighting some of the key policy discussions and considerations we're having, how they're already implemented in various forms and guises on more and more global perspective. So we've had examples for Australia, where they're utilising a longer prescription length, duration and dispensing cycles to try and reduce some of the efficiencies in the service and also improve access for patients and make it easy to get access to medicines and not have to get order prescriptions as often. There are potential knock-on effects and the impacts around pharmacy funding, which we need to consider, but there's some potential opportunities to explore there. There's also great examples, some of the key areas around, so particularly around in the Netherlands, utilising the pharmacist workforce and clinicians more effectively and more embedded as part of wider healthcare teams, which really does resonate with our ambition to be starting now to look at how we can develop neighbourhood healthcare and have pharmacists part of MDTs and things of that nature, really build on our current workforce where we've got pharmacists and GP practice, how we can build that to a network neighbourhood model approach, and then utilising other pharmacists from other settings and pharmacy professionals like pharmacy technicians. Some other good key examples as well around even in our devolved nations, around how work's been undertaken in Scotland to develop the pharmacy services delivered there in a more of a registered patient basis approach and more clinically focused services and more impactful use of prescribing currently in Wales, for example. So there's opportunities for us to learn. I know part that hasn't built into some of the policy developments around prescribing across England and plans, but it does really help us identify opportunities where it's been done in other areas. Now we can bring that into our learnings and share what we do across more globally as well.
And Maria, what would success look like if these recommendations were implemented now to support and enable the ambitions of the 10-year plan?
Yes, so success in these areas would be something like pharmacy being fully integrated into ICB, ICS's neighborhood teams and decision-making boards. Pharmacist prescribers working confidently with clear roles and protected time and actively contributing to population health. Pharmacy professionals and pharmacy technicians have clear defined roles within the entire system, not just in one interface or another. Also, another thing would be digital systems that are unified.
And Stephen, what about you? What would success look like if these recommendations were implemented now to support and enable the ambitions of the 10-year plan?
I think something similar to Ellen's raised. I think integration is a really key part, but you've got integration into the delivery of neighbourhood models and things of that nature. I think better utilisation of pharmacy leadership. And for me, I think the likes of the chief pharmacist role in an ICB being considered a statutory function and required of an ICB. Also, a digital interoperability between pharmacy systems and the wider healthcare systems, not just in private community pharmacy, but also secondary care systems, linking into community trusts, full access to records over time so they need proper read-write access. And I'd like to see as well development of commissioning models for pharmacy services. So as we develop them, it enables and supports pharmacies to maybe work more together as almost federated models, similar to some of our GP federations we've seen now, enabling pharmacies to operate across neighbourhood healthcare settings and manage patient populations as a group, rather than being just paid for an item of service delivery. Also, a key thing for me as well would be to see pharmacist skills more fully utilised, particularly prescribing services delivered through pharmacists more as more the norm, so through community pharmacy settings, better utilising that ability there, managing patient cohorts, long-term conditions and supporting population health management, preventive treatment, but also fully utilising and better utilising our wider pharmacy workforce, our pharmacy technicians who are registered health professionals in their own right, fully developing that role for them as a professional group and an identity for pharmacy technicians, and then also developing our better utilising our wider pharmacy teams as well with the supported infrastructure to be a key healthcare partner in delivery of this 10-year plan ambitions.
And Maria, who would you like to take note of this report?
Yes, so that will be audiences and policy leaders and makers across NHS England, ICB leaders, Department of Health and Social Care, as these arm's length bodies are the ones who can make a structural change happen.
And Stephen, over to you. Who would you like to take note of this report?
I think similar groups of people, to be honest. I think it's our key policymakers and commissioners is really important to see. That's our ICBs, Department of Health and Social Care in the New World. I think as well as key elements around our regulatory body as well. So obviously they can support and how they regulate the profession to enable these changes and enable the developments that we require. Also supporting colleagues to come through, particularly as we get the new cohort of prescribers qualified for this first time this coming year in 2026, how we support them to deliver and support care. And I think a key factor will be our professional leadership bodies of the Royal Pharmaceutical Society, particularly as they're transitioning into a Royal College, is how they can support with the guidance, the standards, professional standards, also developing what good looks like in good practice. And that's going to be key elements as well. But then also as well, there's key colleagues around other healthcare professional leadership bodies and workforce groups, so they can fully understand what we're able to do as pharmacy and pharmacy professionals, and then we can start looking at how we can better link in to deliver with alongside other healthcare professionals back to that approach and integrated to neighbourhood models and things, so we can fully understand what each other can deliver and can do, and then that can make a better utilisation of all our skill sets collaboratively and collectively for patient care.
And Stephen, what are the risks of inaction, and who stands to lose the most if pharmacy continues to be underutilised?
I think one of the significant risks if the profession is not utilised to its full potential and not supported, we will fall behind other healthcare professionals and it will further encroach upon our ability to deliver and support patient care. The risk of part of the workforce perspective, you'll see highly trained health professionals moving into other settings, other sectors, and maybe even out of the profession and taking their skills elsewhere altogether. And it'll be more difficult to recruit and support in the future. It'll impact on our quality of service delivery and ability to support the ambition shifts of the agenda within the 10-year plan. Ultimately, the key people that will lose out will be our general population, patients and the public, because without utilising our skills and abilities as fully and as in line with the ambitions in the 10-year plan and beyond, we won't fully see these shifts being realised. They'll have poorer access to healthcare overall. poorer experience because they won't be able to have that benefit from the skills and expertise and support. And we'll have likely we'll have poorer patient outcomes as a result if this is not fully, if we are not fully utilised.
And Maria, how can stakeholders, whether policymakers, clinicians, innovators, pharma, medtech, how can they get involved with the next phase of this series?
So I think the first thing they can do is join future roundtables and listening events, especially those that include patient voices. They can also contribute by bringing case studies and local evidence that build shared any gold standard stories that they may have that they can share and share best, essentially.
This is all we have time for today. Stephen and Maria, thank you so much for joining me to talk about the report in greater detail. And for our listeners, if you'd like to read the full report, you can find it on our website at www.globalpolicynetwork.com, and you can watch out for future reports from our Roundtable series. Be sure to follow Global Policy Network on all our social media platforms and subscribe to hear new episodes every week. Stay tuned as we have a new series and bonus episode coming up soon. Thank you and goodbye.